The findings were based on the most comprehensive study of its kind, 1 million patients at 4,600 hospitals. Medicare researchers discovered that 1 in 4 heart failure patients were back in the hospital within 30 days, 1 in 5 heart attack and pneumonia patients.
Not only do 1 out of 5 patients come right back into the hospital, most have never seen a doctor from the time of release to the time they come back. That's not good medical care.
And because care can vary widely, the government has put all that data online so patients can see how their hospital stacks up on everything from nursing care to blood treatments. A couple clicks on hospitalcompare.hhs.gov revealed that our closest hospital at George Washington University gave surgery patients their antibiotics promptly 96% of the time, aspirin to heart patients on arrival 100% of the time. But it had a worse than average readmission rate for heart failure patients.
It did surprise me because we do so well on the direct care measures.
Dr. Gary Little is the hospital's medical director.
It makes me want to look at the whole system and to see where the ball is being dropped.
And that is the main goal of this data, to give hospitals the tools for the first time to see how they measure up to their competitors.
It's a wealth of information that'll make us all better shoppers and put pressure on hospital management to do better.
And doing better could save the healthcare system a lot of money. Medicare alone estimates it spends about $17 billion a year on all those heart patients and pneumonia patients who keep getting readmitted to hospitals again and again, Katie.
All right, Nancy Cordes. Nancy, thanks very much. Dr. Jennifer Ashton is a CBS News medical correspondent. And Jennifer, should you actually use this report when you're seeking out treatment at an area hospital?
Not necessarily, Katie. You know, all hospitals might not be equally good or bad at everything. So if you have a choice, you might want to go to one hospital for a hip replacement, but choose another for your breast biopsy.
So how should you then, if you don't want to rely totally on this report, how should you choose the best hospital?
The ratings are a big part of the equation, Katie, but you also want to find a good doctor that you trust, who works with a great nursing staff, who can give you personalized attention. That might be at a big hospital, but it also might be at a smaller community hospital.
So there are a lot of factors, and there are other things like infection rates, which might have an impact on a hospital a patient potentially chooses. Will we be hearing more about things like that in the future, you think?
Absolutely. We've heard about it in the past, and we will continue to hear in the future about hospital-acquired infections, things like falls, medication errors. All will be looked at future outcome studies.
All right, Dr. Jennifer Ashton, thanks so much. For more tips on how to find the best hospital for you, you can go to our partner in Health News, WebMD.com, and search Choosing a Hospital.